Calder, what are the established protocols at hospitals for marking a surgical site, and how often are those protocols not followed, which could lead to a wrong site surgery?
This happens surprisingly often, much more often than you would think. Site marking begins uh, at the pre-procedure verification. When the patient comes in, the surgeon sits down with the patient and goes over what procedure they're going to do to make sure that they have the right patient, that they're going to do at the right site, and they're going to do the correct procedure. That begins with verifying the patient's name, their date of birth, and that they have the correct medical record number. And when they're discussing the procedure, they're going to discuss where they're going to do that procedure. And then either the surgeon or a member of the surgical team will mark that site physically on the patient. And this needs to be done with something permanent, often a permanent marker. It cannot be something that is not permanent. It can't be tape. It can't be a tie. It can't be anything that'll move or be affected by the dressing for the surgery. And it also can't be vague. I know most people think of X. That's oftentimes not allowed at a hospital, because does that mean cut here? Does that mean don't cut this one? And so there are policies and procedures in place at every hospital as to how to go about marking the site and what are acceptable site markings. And the surgical team needs to make sure that they are aware of each hospital's policies and procedures and are following them.